Aging brings with it many charming surprises: mystery joint pain, forgetting where you put your glasses, which are on your head, and a growing collection of pill organizers. But one of the less obvious, sneakier issues that tags along with aging is declining zinc status. And this isn't just a minor mineral deficiency situation. It's a potential health saboteur that deserves way more attention, especially in the over 60 crowd. Here's the thing: as we age, our ability to absorb zinc declines. Your digestive tract becomes a little less efficient, a little more picky, and a lot more prone to inflammation. It's like your gut's decided it's semi-retired and not taking on new jobs without paperwork. So even if you're eating the same zinc-rich foods you did in your younger years, you might not actually be absorbing enough of the good stuff. Meanwhile, your need for zinc doesn't take a retirement break. In fact, your body needs more zinc as you age, especially for keeping your immune system from turning into a creaky, half-functioning relic of its former self. Zinc is crucial for maintaining proper T-cell activity and moderating inflammation. Without enough zinc, your immune system doesn't just slow down, it becomes confused, sluggish, and borderline passive-aggressive. That's why low zinc levels in older adults are linked to increased rates of pneumonia, longer recovery times from infections, and a generally higher risk of ending up in the hospital for things that a younger person might shake off in a weekend. But it's not just your immune system at stake. Zinc is also essential for brain function in older adults. It helps support neurotransmission, reduces neuroinflammation, and assists in maintaining synaptic plasticity, aka your brain's ability to stay flexible, adaptable, and not get stuck in "where are my keys?" mode. Some research even suggests that zinc supplementation could help slow cognitive decline and reduce the risk of degenerative conditions like Alzheimer's. That's a big deal. It's not quite the fountain of youth, but it's at least a mineral-sized nudge in the right direction. And don't forget Frailty, the real end boss of aging. Zinc helps with muscle maintenance, wound healing, and energy metabolism. If your zinc levels are low, everything from getting out of a chair to recovering from a small cut can take longer and feel harder. It's not just about living longer, it's about living with enough strength, immunity, and mental clarity to enjoy those extra years instead of just enduring them. Yet despite all this, zinc deficiency is shockingly common in older adults. Estimates suggest that up to 30 to 40% of the elderly population may be running low. And it's often missed, partly because blood levels don't always reflect true zinc status, and partly because doctors are usually more focused on the big stuff like heart disease and diabetes. But if you want to prevent that big stuff, or at least give your body a better fighting chance, zinc needs to be part of the conversation. So, what's the solution? Simple. Keep zinc on your radar. If you're over 60, it's worth looking at your diet and asking whether you're getting enough. Are you eating enough meat, shellfish, or legumes? Are you taking medications that impair zinc absorption, like proton pump inhibitors or diuretics? Are you dealing with digestive issues that could be silently sabotaging your nutrient intake? If yes, zinc supplementation might not just be helpful, it might be a quiet lifesaver. Supplements are inexpensive, widely available, and generally safe when taken in the right dose, usually 8 to 11 mg/day for older adults, though some may benefit from more under medical supervision. Just don't go overboard. Zinc isn't the kind of mineral you megadose for fun. Too much can interfere with copper absorption and ironically mess with your immune system. Like most things in aging, balance is everything. So yes, it's true. Zinc isn't sexy. It doesn't come with a hype train or fancy branding. But for older adults, it may be one of the most underappreciated keys to staying stronger, sharper, and more resilient. Think of it like WD-40 for your immune system and your brain, small, subtle, but absolutely essential to keeping the machinery running smoothly. You don't need more magic pills. You need smart, science-backed basics. And zinc just might be the quiet hero aging bodies have been waiting for.